Welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Happy Monday, everybody, and welcome to Brain Chat. I am Dr. Mitzi Joy Williams, the nerdy neurologist, and I am so excited to be here with you all to discuss MS in the Hispanic and Latinx community. I have an amazing guest with me, Dr. Liliana Amezcua, and we have got an awesome discussion coming up. So I cannot wait for us to get into it. All right, so we're going to go ahead and get started. For those of you who have not been to Brain Chat before, you can log into the chat and tell us where you are viewing us from. And I'm going to go ahead and introduce our guest. So Dr. Liliana Amezcua is an associate professor of neurology, and she is a diversity, equity, and inclusion champion. I know from the many projects we've worked on together. She is also the fellowship director at the University of Southern California Keck School of Medicine. She's the acting chief of the Multiple Sclerosis Division. She received her undergraduate degree from the University of California at Irvine and her medical degree from Jefferson Medical College in Philadelphia, Pennsylvania. She is she spearheaded the Collaborative Research Consortium, the Alliance for Research in Hispanic MS, and serves as a principal investigator. She has many more amazing qualifications and is definitely an expert on this subject, and I'm so excited to have her with us tonight. Welcome, Dr. Amezcua. Welcome back to Brain Chat.
Good to see you, and buenas tardes, because I'm going to say it in Spanish. It's Hispanic Heritage this month, so I'm going to, try to own it, and as a result, I'm wearing a little bit of this Hispanic heritage in me. Of course, I wear it in my skin every day, but
I see it. Yes, so that is one of the reasons I want to do this topic, because it is Hispanic Heritage Month. So I thought it was very appropriate for us to discuss this on Brain Chat, and you are the premier expert on this topic. And so I want to get right into it. So first, before we get started, always on Brain Chat, I have you tell us a little bit about what got you involved in MS, particularly when we think about MS not being a disease that's commonly been thought to occur in the Hispanic, Latinx community or in the African-American community traditionally. What got you involved or interested in MS?
It's a really simple question when it comes down to just, who was I treating? So, I started as a neurology resident in the University of Southern California and the Los Angeles General Hospital, which is the new name of old LA County Hospital. And there, as I was, taking care of MS patients, one of the things that I was noticing was that a lot of my patients were Hispanic, Latino, Latinx, and so I just felt perplexed with what I had been taught about MS. MS being predominantly a disease in white people of Northern European background, and so I asked my mentor at that moment, Dr. Leslie Weiner. I said, I feel that I don't know, is it just because I'm here in LA, which is 20 million, 10 million people, and about 60% of the population has a reference to a Hispanic Latin background. And, is it because of that are we seeing more MS in this population? Do you think this is new, or do you think they've always had it? And this is, well, I can't tell. What does the literature say? And I looked at the literature at that time, and, we're talking about early 2000s, 2004 to 2006 or so. And there was hardly anything. There was one paper that I had found that was descriptive about MS in Hispanic people in Texas. And I believe that was Dr. Rivera, Victor Rivera.
Yes. Yeah.
And so that was it. And it was in a very, it was almost like a report, not a peer review, area of a manuscript. And so I said, there's not a lot of data, but what we do know, sort of the prevalence is just so low across Latin America. Do we have any information here? And of course, we didn't have any. And I was just really desperate to try to better understand the population I was seeing. And one of the things that I was also hearing from the patients was that every time, let's say I had a new diagnosis to give to this population, they would look at me and they would say, but I read about this and it says it's a white disease,
Right.
So very sort of, I would try to validate, that they were, well, Hispanic people are an admixed population and maybe the European background without even having any data to substantiate what I was saying. But meaning I was trying to validate for them to feel like included because they felt excluded by,
Right.
would search something about MS. And so that led me to, to start thinking about, hey, what can I do for this population? And so I started, at that time I was now a fellow in multiple sclerosis funded by the National Society. And I reached out to them and I said, is there any, at that time there was a lot of educational programs that were being done. And I said, can we do some in Spanish for this population? And so from there, I started getting to know the population, getting interested, and I felt it was my duty to sort of, it's like, well, let me try to define at least what the clinical observations that I'm seeing here in the clinic. And is it true? Is it really what I'm seeing? Is it a perception? Or is there really indeed some differences that I think are happening or that exist between this population and, my the white people I do treat?
Yeah. So I had a very similar experience with looking at MS in the African American community. We had a little bit more literature than you had for the Hispanic Latinx community, but it was still very little, So it's been amazing to see how far the knowledge and understanding has come. A lot of that is due to a lot of your amazing work, you as well as the Arms Registry. But so let's kind of take a 50,000-foot view. How common is MS in the Hispanic and Latinx community?
Well, I will say it differs across regions, right? So Hispanic people, Latin people, right? We're talking about, if we look at, Latin America, that prevalence, it differs by country. And, prevalence and incidence, very small. We're talking about numbers in the 20 per 100,000 in most regions or even lower. And with sort of the highest ones at, understanding was Argentina. And then more recently, we've learned that actually the highest prevalence, and we've been seeing it steadily go higher as well as the incidence, is in Puerto Rico. And so it's getting closer to digits of 90 per 100,000 percent. So it's increasing. And one of the things that's happened in Puerto Rico is that certainly there's a sort of island registry. And so that island registry, which is led by Dr. Angel Chinea, is certainly has given sort of a the ability to collect those cases, know where they're coming from around the island, and giving a better calculation of how many people are affected with MS. And but for the United States, huge country, right? And sort of the first sort of observations of what MS, how many people of Hispanic background are living with MS, or the incidence came from Kaiser data, Kaiser data here in Southern California by Dr. Annetta Langer-Gold, and, noting that, it is definitely not as prevalent as what has been found for Black people, right, compared to white people. And so we're talking about at least, 20 times higher than what is shown in the prevalence in Latin America.
Wow.
The latest, and you are quite familiar with it, right, is, noting that, the latest prevalence study that was able to look at regions as well as race and ethnicity, published in JAMA Neurology, when they examine, the prevalence in 2008, 2010, using a lot of these medical claims data. It's basically, when we look at it, I mean, Black people are getting up there, right, close to white people, right?
Mm-hmm.
But for Hispanic, if we want to translate it to this, sort of practical way, it still shows that 1 in 1,000 people of Hispanic background is living with MS. And we're talking about 2010.
Wow.
What has happened between 2010 and now? If we just talk about the US Census of who the Hispanic community is, it is the fastest growing, right, population. I mean, the growing population, we're expected, right? It's a 23% growth from 2010 to 2020. So we haven't even counted the last 3 years. And so what do we think the prevalence may be now? It may be very different, not necessarily just for Hispanic, but also for other, people of color, because one of the things that has also increased, and it was noted already, there is visible in that prevalence estimate, is people other, right, multiracial.
Yes.
Multiracial people, right? Yeah. So multiracial, claiming more than one race. One of the things that is happening in Hispanic people and Latinx is that they are starting to claim their color. Before, they might mark probably predominantly white, but people are starting to accept and be vocal of, if they are a Black Hispanic, but also if they're multiracial. And in fact, I just looked at the, sort of the numbers of people of Hispanic background reporting more than one race increased 567% from 20 to 2020. Yes.
Wow.
More than one claims other. And so Hispanic people may not be necessarily all under the umbrella of Hispanic. They may be under that multiracial. So these are just things to consider as,
Absolutely. And it's so important, right? Because we talk about this and we're talking about how we categorize. We often in science put people in one box, but people are having multiple boxes, right?
Multiple boxes, right?
So how do we really capture that information to where a person feels authentic, like they don't have to choose one box or the other box, And so how do we capture that and categorize that? So let's break down the term Hispanic.
Do we need to categorize, right?
Absolutely. Do we need to categorize it, right? So let's break down the terms Hispanic, Latino, Latina, Latinx. Break it down for us because, there often is a lot of discussion when we talk about terms, when we're presenting a paper or when we're writing a paper. What's the correct term? Is it Latinx? Is it Latino? Is it Latina? Tell us a little bit about what those terms mean and what those groups are comprised of.
Exactly. So, I mean, Hispanic and Latino or Latina, it differs in respect to what you include under that box, right? One includes Spain. The other one in Latin, you're able to include the non-Spanish speaking countries, Brazil, right, for example. And however, the preference of using one or the other comes down to some of it is social, some of it is political. And so, in the United States, there was a need to categorize a certain way. And my understanding, one, it could be, differences by party. We're not going to say different parties, but and so it comes down to that. However, you can have a Hispanic, both of, let's say, an example referencing of ancestry to Mexico. One will call themselves Latin, and another one will call themselves Hispanic. So there's really no, sort of good concordance between both of them for people. And I think it just comes down to historically what you might have been called, how you call yourself with friends or family. And but throughout Latin America, people do prefer to just call themselves where they're from, right? I'm from Mexico. I'm from Argentina. I'm from here. And then more recently, this Latinx term came to, proposed to be, gender neutral, because in Spanish you have the A and the O for Latina and Latina. And but there was a peer report, right, on who prefers Latinx, and so far it's only about less than 15% that accept that term.
Wow.
So I have a feeling these terms will again continue to evolve. However, most of the time in the census, it just reflects, people use Hispanic. Certainly in our reporting for a lot of our studies, sometimes you use one term, but you're really trying to put an umbrella to all of them, right? You're saying, we're also referring to Hispanic, Latin, or Latinx. But I have a feeling things might change. I have a feeling, same issues with, this broad category of Asian, right? And so we have sort of a problem, but I think, for now, I always prefer to include all, and then maybe just one thing throughout the manuscript, or unless I'm told by the editor, use both, right? But, you're just trying to make sure that every Hispanic Latin person is included, and we are referring, depending on the region that we're looking at. For example, in the United States, you put both.
Yeah. So let's talk a little bit more about kind of characteristics. So, you've written a lot of research about, some of the characteristics that may be different about MS in the Hispanic Latinx community. Give us kind of like a, 50,000 foot view of what potentially some of those differences are. And then also, I think the next part will be, what do we think is due to, right? We always have these questions about genetics. You've done a lot of genetic research, and talked a lot about how there are differences in different Hispanic communities versus the Mexican community versus the Puerto Rican community. Genetically, there are some differences in background, but we want to talk a little bit about, what do we think they're due to? Social determinants of health, what kind of the role of those? But first, just kind of tell us broadly, what are some of the differences that we see in the Hispanic Latinx community in terms of the MS, how it presents?
So some of the important differences that we do see, and we continue to see, because I think this is one of the very first sort of observations as a clinician and being there, was that this is most of the time a younger population. So their age of onset, be it that first clinical event or diagnosis, tends to be much younger than what we usually see compared to white people. And I'm talking about adult onset MS, right? To differentiate from pediatric. So, when we estimate sort of that difference, it could be 3 to 5 years younger than, sort of, again, comparing it to a population of white patients. And these differences can significantly differ if that individual is US born. So what we've seen is that also US born, and not only here from our studies here at USC, but also University of Miami, was able to see that those that are US born appear to be, younger at the time of diagnosis. Now, one could argue and say, okay, well, they get to the doctor faster. They perhaps have better insurance, right? Maybe, that's what's driving them. It is possible that that's the reason, or even health literacy, who knows, right? Compared to the to the one that is foreign born. But what we do also see is that those that are foreign born are at risk of higher disability. And again, what may be the causes? It could be multifactorial, of which one is maybe they did start with age at an older, older
Right.
onset, or is it an issue of access to care, recognizing the symptoms and putting it together that this could be MS? Of interest is that when we look at the time of, of migration, is not, most of these cases are not coming with MS, but it appears that there's this, sort of 15-year gap between the time they migrated to the time that they developed MS, which kind of tells you, well, it could be environmental factors now
Right.
encountered in this new country, right, where higher prevalence of MS exists. And so the factors, of importance may be much, are here more than their country where they're coming from, right?
Right.
So those are, a specific, sort of observation. The other one that we do see is that it appears, and this has, and, depending on the region in the United States, is, for example, here in Southern California, as well as Texas, patients of Hispanic background, it appears they're 2 times more likely to present with optic neuritis. And most recently, the study that, again, independent, separate study from ours, which was, back from 2010, but Carlos Perez from Texas was able to show that, and these were gender and age matched patients to compare to white, and you could see that very strikingly that optic neuritis is particularly, again, dramatic, more than 2 times, more likely. So whether there are genetics or is it all environmental behind, where lesions are developed. I mean, I think there's still, there's potential answers for both. Yes, and so one of the things that we did was we took over 1,000 patients of Hispanic background between Puerto Rico, Miami, and us. And we examined, obviously this issue of optic neuritis presentation. And we found that, at least from the genetic admixture diversity, you can see differences, between the patients. So certainly, even though you could see differences, for example, Puerto Rico and Miami had a lower prevalence of optic neuritis, so lower frequency of optic neuritis. Once you look at genetic admixture, those that presented with optic neuritis didn't matter where you lived. It was, those that had more Native American background were 2 times more likely to present with optic neuritis. And that was independent of African ancestry and other variables. What we're also, able to see was that age of onset too. It seems to be driven by that Native American ancestry independently, but also African ancestry can drive to an earlier age of onset in Hispanic patients. And actually, that one was even more dramatic, could drive the age of onset by at least 10 years versus Native American, we saw it 5 years. And we saw the African ancestry, having a higher sort of magnitude of effect. And so there's something about that probably should be explored at a deeper level, more at the, sort of local ancestry. We were just getting general, sort of global references, which can still capture some of the, environmental factors, but one can, sort of look deeper to see if there are actually specific genetic, predispositions to develop.
I mean, so this is so fascinating to me because, as you know, this data did not exist, right, when we came out of training. So when we think about, wanting to get to the bottom of genetic differences, obviously, historically, there's been a big push to make sure that people understand that by and large, we are all very similar, right, genetically. So,
More,
we have to we want to balance that. Yes, there may be some underlying differences that may drive certain things, but overall, we're all very similar. So when we think about why we see worse outcomes in particular communities such as the Black and Hispanic, Latino community. Talk a little bit about social determinants of health and how those may play along with, or how those may interact with, for instance, biologic differences to lead to some of those outcomes.
Yes. So really, really important. And as several years ago, this concept of social determinants of health was, always put on the side. People did not consider this to be science, right? And it was hard to talk about it, right? And people sometimes equate social determinants of health to access to care, which I do want to make a point that is not the same. It is part of social determinants of health. So social determinants of health are those factors, right? Social conditions that we are born to, live, grow, and die to, right? And they have tremendous capacity to affect our healthcare outcomes, right? Are the way, disease comes and goes or stays, right? And in many cases, particularly communities that have been disadvantaged for many reasons, right? Either from, economic deprivation or discriminated or ignored, they can be at higher risk, right? Because social determinants of health represent, these factors are not at random in many cases, right? They were distributed intentionally in a certain way by where the countries that we live in, all the way. And so these factors have been noted to have capacity to explain a lot of the variability that we see in health outcomes. And so, for example, in multiple sclerosis, right, we were able to note that, for example, Black people as well as Hispanic people affected with MS are at higher risk of being affected by these issues. And so some of these issues are as simple as, misinterpretation of, of some of these tests that are conducted in people of color and referencing back to a white population and not referencing back to their own controls. And so this is really important, right? Education, and the socioeconomic areas or incomes that, patients affected with MS really need to be compared to appropriate references. What we do see is, for example, differences in who has access, for example, to a specialist, right? So for Hispanic people, data suggested by society was that, they are 40% less likely to have access to a specialist, right? Which is very similar to Black people, which is 30%. So really, they're all having difficulty getting to a neurologist. And why is that? Is it all an issue because they don't have the appropriate, next to them a neurologist, or is it an issue that they are not being referred to the specialist by primary care, or their symptoms being ignored? So I want to also consider, it's not all on the patient, that some of, these social issues also pertain to us health providers and the systems that they get cared in, right? Because they did not, we or the physician did not think about MS because of the color of their skin or their background. And they're still reading ancient, or not too ancient.
Very old studies. I still have people coming into the office and saying, Dr. Williams, somebody saw me and said, Black people don't get MS. You can't have MS. I mean, like in 20.
You still hear those stories.
Yes. So
2023, we haven't done enough to change that yet. All over.
We still got some work to do. We still got some work to do, but the bottom line is anybody can get MS, right? The other thing I think is important is that, certainly there is a risk for poorer outcomes in some groups, but it also is not a guarantee that because you are Black or because you're Hispanic that you're going to have horrible MS, right? So I think we want to make sure that we are, I always encourage people, go to the doctor, get seen. If you can see a specialist, try to see a specialist. But again, no group of people is a monolith, right? Everybody is, MS is a very individualized disease. But it certainly is very important to examine these populations that have for many years been overlooked as part of the MS community, which is why we don't have those reference groups, to kind of say what's normal, what the normal course of disease is, because there's just been very low enrollment of these populations in our clinical studies.
Right.
So we think about, you talked a little bit about access to care. So what are some of the barriers to care that are specific to the Hispanic Latinx community? Like, we know that certainly language is one, but I've heard you talk many times about different, belief systems about where their MS may come from and how, tell us a little bit about that.
Yeah, so certainly, I mean, I think, from the Hispanic population, there are a number of barriers that, not only are pertinent to MS, but in general, as, again, in a general fashion, right? Because you can find these all over. But yes, cultural and language barriers can be big. Of course, you're talking about a population where there is a different, language that can be present, right? Spanish, but it's not only the Spanish issue, is the cultural aspect to it. How acculturated are they to the US way versus their old, the ways of their country can differ. And those are enough to cause changes in how you access or take care of your health. And it's not necessarily because they don't want to take care of it. It's just their belief systems are different, right? What has been shown, and again, does the lower level of health literacy have anything to, is it just because they're Hispanic? No, it's because, again, we're talking about here a disease that's not been quite prevalent in this population. So their literacy is lower, not because they're less educated, is because there's not been enough advocacy or, talking about MS in this population. Right. So
there has been, let's say, a lot of talking about diabetes and hypertension, right? Those conditions are very familiar to minority ethnic groups, but MS, not so much.
Not so much. And, and with diabetes, and, you can see a lot more of what that diabetes looks like. And someone with diabetes, in many cases with MS, you don't know anybody else, right? Or if you did, because MS, maybe they knew someone that was using a cane early on. And some of the cultural aspects of of Hispanics is that sometimes you don't necessarily ask what that patient has. And it might be a family member, you just integrate them, but you don't talk about their disease, right? There's also an issue of who has insurance and the type of insurance. Unfortunately, this population is a greater percentage of them, about 15%, don't have, have low insurance. And so low insurance means lower access to specialists, unfortunately, right? And this is a very specialized disease. So that can be a barrier. Also, the cultural aspects is that if there are social cultural, perceptions of the disease, we have shown that it can probably hinder their ability to wanting to take a disease modifying therapy, which is so important in this disease. But also, they feel the need that they need to be, sort of understood by the family about what MS is before they can make a decision. And that we have in sort of our focus groups where, it's so important for them to not just know about the disease, but they need their family members to understand the disease because that will help them make decisions. Another thing that was really interesting that I found out was that a systematic review that was conducted found that close to 70% of healthcare providers held moderate levels of implicit bias towards Latinos. And so
I'm
sort
not
of
surprised.
on the other side, right? So these implicit biases and, can hold negative attitudes, right? Towards, between that patient physician relationship. And so it causes them to refrain from discussing all their symptoms and their issues with the doctors, right?
Mhm.
Which further just exacerbates the, sort of health disparities.
Yeah.
So in the way that we address them, right? And it comes down to this so cultural, humility and competence that, to facilitate, we need to be facilitators in
Mhm.
allowing people of color and diversity to feel welcome, that this is a safe space for them to talk
Right.
about their symptoms and their perceptions, as irrational as they may be, right?
Absolutely.
And not
Absolutely.
call them crazy because they feel, MS
Mhm.
was granted from something, Um,
Exactly.
and
Yeah.
but overall, I mean, what we do see is that, you know, uh, another thing is that, and this is not only to Hispanic, but also was found in Black people, or at least living in Texas, from Orlando's recent paper, was that, they're dealing greater with distance issues, transportation to care,
Mhm.
be
Mhm.
a barrier, and when you compare them to white people, and they're, they have a higher percentage of them are living in socially deprived
Right.
neighborhoods. And again,
Right.
a lot of these
Yeah.
neighborhoods, again, are the result of, sort of segregation practices, you name it.
Absolutely.
Yeah.
Things that started long, long before many
Long,
of these
long
people were
time.
even
Right,
born.
exactly. Right, right.
Absolutely.
Which gets daunting, right? From
Yeah.
a perspective of, what can we do?
Yeah,
Well, we can
exactly.
actually do a lot. We can actually
Yeah.
do a lot. Yeah,
So
but
so where do you start, right? So I know we don't have another 5 hours to talk about that, but where do you start, right? So, in tackling this issue of health equity, there's so many different layers to it, right? There's patient empowerment and activation, right? Trying to educate the patient population to advocate for themselves and their care partners. But there certainly are structural issues, right? We talk a lot about increasing diversity in our clinical trials, being intentional about how we reach out to communities about the importance of research. So, what would be your, let's say, top two places to start if you had your magic wand and you could wave it anywhere? How do we begin to tackle this problem and kind of break down some of these barriers?
well, I think, you know what? You're doing it right now. It's this right? It's brain chat programs like yours that are able to reach the community and others, bringing people like us to talk about it. Like I
Yeah,
said, this topic was so difficult to talk about it 10 years ago. And,
absolutely.
you and I, we've been doing this. I've been doing this for a long time, right?
Yeah,
It a long time for people to acknowledge that, or accept, and we're talking about our own community of clinicians and
right.
scientists, to
Hmm.
actually say these people are getting MS, even if at the time it was perceived at a lower rate,
Hmm.
that they deserve to be, included in clinical trials, but also
Yeah.
deserve for us to take a look at how their disease affects them. And
Hmm.
and so it took a while, right, to talk that internally.
Yeah.
Now it's really, let's talk about it. Let's feel comfortable with the subject,
Yeah.
and invite our patients and recognize that their perceptions, and very clearly, right, we both were part of these studies, that we understood that their perceptions of what research is doesn't
Hmm.
defer to what, it's not disease specific, right?
Right.
They have the same perceptions as for what has been found in other literature of other diseases, is
Hmm.
that they're concerned about what we're gonna do with their data, right?
Absolutely.
They're concerned that they're gonna get lower quality of care. Um,
Absolutely.
yeah, and so,
And in many cases, historically, they have a right to be, right?
absolutely,
there are numerous documented things that have happened that have been detrimental. And even with concerns about your data. If I give my phone number or email to one website, the next thing you know, I get 50 emails that I didn't, so those are valid concerns. And I think it's important for us not to discount them, but to
Mhm.
try to address them, as realistically as
Exactly.
possible. And
Right.
also to try to see how we as scientists can renovate the way that we do research or reimagine some of the
Exactly.
ways that we do research in order to make it more accessible to
Absolutely.
everyone. Yeah,
Absolutely. And I also think so important to support initiatives that are specific to them. So your
absolutely.
registry, my registry, they need to continue for now, right?
Absolutely.
Eventually, yes. Do we need any specific ones? Hopefully not. But for
Right.
now, they
We need,
deserve they deserve to be seen and
yes,
heard. And
absolutely.
and we need to hear them. We need to, hear them. Of course, we want to learn about them genetically, epidemiologically,
Right.
socially, right, environmentally, but we, and obviously also clinical trial initiatives like the
Mhm.
Chimes study.
Absolutely.
Such a huge sort of, it was I think a breaking point
Mhm.
to sort of say, hey, how much have we learned, Mitzi? I mean, we've learned so
Yeah,
much. Yeah, and we're not
absolutely.
even done with the study, but
I know,
we've
it's not even done. Like, I just get excited every time
so
I think about it.
exciting. I mean, the enrollment that occurred during COVID, these
Absolutely.
people, they're hungry, we're hungry. We want to know about them. They want to know
Absolutely.
about their disease.
Right.
And
Right.
uh, and then, of course, from advocacy and from research foundations and NIH, we need to support health disparity research um,
Absolutely.
because it's so important. I mean,
It's
I don't know
so
if you saw the latest, neurology paper. This is over,
I haven't
just
read it yet, but I'm
yeah, this
excited to.
yeah, this is just in general about mortality and
Mm,
how many lives could you have saved. Sort of the over excess of you know of deaths in neurology of
mm.
if you're Black.
Wow.
If you're Black, there's, we could have saved more lives just,
Right.
and so these are really important things that
Absolutely.
we cannot
Absolutely.
ignore.
Absolutely. So tell us a little bit more about the arms registry and how people get involved in that if they're able to. Tell us a little bit more about it.
Yes. So the Alliance for Research on Hispanic MS, or ARMS, was, I spearheaded this with Jake McCauley from University of Miami and Angel
Mhm.
Chinea, as well as Jorge Oxenberg at UCSF. And this was, over 10 years. And it was very simple. We came together and we said, hey, I have a registry, you have a registry. Can we align it? And can we, of course, to welcome patients being of Hispanic, self-identified, right? Because you have to
Mhm.
self-identify with MS, and
Mhm.
uh, and so we collect, their medical records, we collect questionnaires, and we take blood
Mhm.
samples for future
Mhm.
genetic and now immunological studies. And we've been
Mhm.
doing this, and with great success. Of course, we have not, step by step, right? We started off with a lot of sort of, just descriptive and, genetic analyses.
Mhm.
And anybody can participate. Again, if you're Hispanic and you have MS, you can go to the ARMS website, and which is just arms.org, and you can contact one of our coordinators by phone or by email, and we'll reach out to you and see and get you enrolled. Of course, it's free, and together, I mean, we have learned so much, and
Wow.
none of this data that we have could be without their participation, right?
Absolutely.
For any
Absolutely.
study, and so really, really, just really grateful so far from all the different funders and supporters, but it needs to
Mhm.
be kept alive, right? Just like
Absolutely.
any registry,
Mm.
and
Absolutely.
it's keeps on going. Right now, we have almost 3,000. I think it's reached the 3,000.
Wow.
Uh,
3,000. That's
yeah, so
amazing.
100,000 from each site, and so again, it's steady. Slows down sometimes depending on on what's going on in the world, like COVID when it was happening. But other than that, we try to catch everyone and invite them. It's an
Yeah.
invitation.
Okay, so last question as we're coming up toward the end of our time. What are you excited about? What projects or initiatives or studies? What are you excited about in this space to help us to further our information, to further our knowledge, to improve outcomes? What do you get excited about?
Well, I'm just really excited right now. I mean, I think, one of the things that comes to mind right now is that we have some biological data that's being collected at Chimes. Can't wait to
Mm-hmm.
see that because that's going
Mm-hmm.
to be important. We're
Mm-hmm.
also looking at, some immunological behavior within our patients. And this is a study that I'm with Tim Vartanian and Nancy Mosen. And
Mm-hmm.
compared to controls that will give us some information in terms of even, why, particularly in the Black population, right, you see some preference for B-cell therapy. Well, is it also
Right.
true Hispanic?
Right.
But the other aspect is that we're about to analyze 500 patients of Hispanic background and multitude of social determinants of health to try to better, understand what can we do and sort of develop strategies. And then, of course, you and I are involved in the diversification of clinical trials. And I think that is done. I mean, I think moving forward, and it's just cannot be ignored.
Yeah.
And so I think, making this a world issue, right, an international issue, it is not
Absolutely.
just a U.S. issue.
Yes.
It is a world issue.
Mm-hmm.
Then, there'll be more voices, more support, that MS is global. Of course, there are regional differences in what we
Mm-hmm.
need to tackle, but we can tackle this.
Yeah, I would agree. I mean, I'm very much excited about the same things. Just the fact that we can have conversations like these and they are not dismissed, or not thought of as important, right? So I think it's a very exciting time to be in the MS space, but I think we also have to continue to move forward, right? Make sure that this is not something that just goes by the wayside, after it was a really hot topic for a year or two, but that we continue the work. And so
That's
I'm
right.
always excited to talk to you because you're doing so much amazing work,
No,
and
I'm
to
excited for what you're doing too. I know this talk was about me, but
yeah.
we're turning around with Mitzi Williams.
Yeah, well, we've got some cool stuff going on, so
And we
I
have our
cannot
chapter
wait to
coming
see.
up soon, right? Our
You said
chapter
what?
in
Our
Neurology
chapter, yeah, our
Clinics.
chapter that just got
Yes,
published in Neurology Clinics.
everybody should be reading it.
Absolutely, absolutely about MS in diverse populations. So, it is always a pleasure, Dr. Amescua, to have you on Brain Chat. I mean, you're just a wealth of knowledge and always so inspiring. Thank you for all the amazing work that you're doing. Thank you to those of you who've been watching Brain Chat, and we will see you again in 2 weeks. Thanks, Dr. Amescua.
Thank you so much, Mitzi.